NEET platform, and today we're going to talk about very important topics of the cardiology. And today is a small test. First, we'll have a test of 25 MCQs. It's from the general pediatrics topic. And first of all, let me know whether my voice is audible to everyone. Please put a message in the comment section. Thank you. क्या मेरी आवाज़ आ रही है आप तक? अगर आ रही है तो बताइए, अगर नहीं आ रही तो बताइए, ताकि हम जल्दी से सेगमेंट को शुरू कर सकें। यस, मुझे मेरी आवाज़ आ रही है, करते हैं। Okay, so for the newcomers, most importantly in the Unacademy, first of all, I would like to say that we have this amazing, mind-blowing NEET PG quiz contest which is gonna happen, which is basically on the 23rd of January, guys. 23rd of January, we have this mind-blowing contest. Basically, you have 60 MCQ, 60 minutes will be given, and 45 MCQs are there basically, and you have to question. You have questions from medicine, derma, anesthesia, psychiatry, and radiology, and all you have to do is give your best of the best answer. And most importantly, if you win, what will you get? Nothing you'll get. You only get 10 lakh rupees, only 10 lakh rupees. लगता है थोड़े से ज़्यादा हैं, तो प्लीज़ पार्टिसिपेट, इट विल बी फन. एंड ऑल्सो अगेन अ वेरी ब्यूटीफुल, वी हैव दिस free test calendars, my dear friends, for the in the Unacademy segment. We have this free test as March is coming very close, and my birthday is also coming very close. So give as many tests as possible. And also at the same time, we have something known as plus subscription and something known as iconic subscription. In the plus subscription of Unacademy, you get the access to all my live and recorded classes. You get to study from the best of the best educators all over the India. You get to participate in various live tests and quizzes. This is the plus subscription. Whereas in the iconic subscription, most importantly, you get what you called the Unacademy platform, and also at the same time you get the prep ladder subscription, all the clinical notes, video lectures, question bank, rapid revision, and the treasure notes. Everything you get of the what you called iconic subscription. मैंने कैप डाली हुई है तो मेरे बाल उठ गए अभी. Also at the same time, in the Unacademy, we have a special class. If you're a newcomer, please download Unacademy, and we have this special class feature basically, which basically in that segment you can ask me any doubt anytime. All the lectures are recorded, so it's easy for us to have a nice category of all the videos. These are the special class features. Okay, that's it. Let's start this beautiful session. So please remember, we do have this what you called free educator test. For example, we have this one, Pediatric Anatomy by Dr. Mona Lisa. We have this very nice test on the 21st of January, 9 p.m. And rank 1 again, 5,000 rupees vouchers, then 3,000, 2,000 rupees vouchers. Amazon gift vouchers are there on 21st of January, 9 p.m. Now give as many tests as possible. Just January, February, and March, give huge test. Okay, and also at the same time you can use this code because these tests will be locked. If you use this code, then the test will unlock and you can give the test anytime. Okay, so it's nice. Okay, and let's start this amazing segment. Now this is kind of a last series for cardiology, and then we have to start a new system. Cardiology is almost coming to an end, and today but I'll be taking a test on random pediatrics, not on cardio, but random questions I'll be asking you. And then we will finish our topic of congestive cardiac failure. In the morning class we were at the congestive cardiac failure topic. We will finish that, but before that I would like to ask few important random pediatrics questions. And before starting any test, we always have this motivating quote. And today's motivating quote, I would like to thank Dr. Savan, one of my junior. He had sent me the quote and I loved it. The quote is, suffering is not holding you. You are holding the suffering. Suffering is not holding you. You are holding the suffering. Things are in your mind. The past has gone actually, but still it is haunting you because still today you have made those past memories very alive in your mind. So suffering is not holding you, actually you are holding the suffering. So let it go. We say that saying, right, that बदलते हुए वक्त को अपनाओ. So बदलते हुए वक्त को अपनाओ. Accept the present, accept the changes in your life. Don't get stuck, don't hold yourself with the old thoughts and old feelings and old moments. Move on. Let it go. Let it go. I told you, some people take 6 months out of depression. Some people takes only 6 days out of depression or out of sadness or out of negativity. So which category you fall into, 6 months or 6 days? It all depends on you. So suffering is not holding you. You are holding the suffering. Okay. And now we're gonna start the test. So our amazing mind-blowing test, I have made a PDF format. Yes, now this test, I want you all to participate as much as possible. And again, some are MCQs, some are not the MCQs. Give your best shot. What is token breastfeeding? What is token breastfeeding? I'll be asking you top 30 questions on breastfeeding. Let's see if you have really read breastfeeding, if you have really revised the whole, pediatrics and gynae also. So what is token breastfeeding? Hello Rachna, hello Mani, hello Savan, Shubhangi, Husna, and Raghuvansh Mani Tripathi. So token breastfeeding could be a new word for you. So remember, my dear friends, what is token breastfeeding? Just remember this part. Token breastfeeding. Token breastfeeding is nothing but, most importantly, if an infant mostly have other food but still breastfeeding occasionally. This is known as token breastfeeding. Some of us might not be knowing this answer. It's one of the rare question. What is token breastfeeding? Token breastfeeding is nothing but if an infant mostly have other food but still breastfeeds occasionally, it is called as token breastfeeding. Okay, remember please. So Saman, put your in your notes, please write this one. Token breastfeeding, what is that? A baby who is mostly on other food but occasionally he is having breastfeeding, that is known as token breastfeeding. Token breastfeeding, that is the first point. Second, okay, question 49, I think it's very easy. Let's see if anyone can answer. Through the night feeds, which hormone is more secreted? Very simple question. We have done this also. Through the night feeds, a mother who is feeding, one mother is feeding at the daytime and one mother is feeding at the night time. So if a mother will feed more at the night time, which hormone will be released more? Will it be the oxytocin which will be released more, or will it be the prolactin which is the released more? Anyone, any random guesses? कौन सा ज़्यादा secrete होता है रात को? Is it the oxytocin hormone or is it the prolactin hormone? So Rachna, yes, very importantly, yes, Rachna is right. The answer is prolactin. Very good, Julie Tyagi. Very good, Savan. Very good, Shubhangi. So prolactin. Prolactin basically secretes more in the night. Please remember the mnemonic like PPOO. So prolactin produces the milk. Prolactin produces the milk, whereas oxytocin oozes out the milk. Okay, prolactin produces the milk and oxytocin oozes out the milk. So prolactin is the hormone. Mani Prakash, remember dear, prolactin is the one which is more secreted in the night and which has a early morning surge is more. That you should know. Question number 48. Option for individual other than breastfeeding. Option for the individual other than breastfeeding, replacement feed should be AFASS. The question is, if I am not able to give breastfeeding, then my replacement feed should have AFASS. What is this? What is this AFASS? Any random guesses? A replacement feed should have these all properties. There should be AFASS. Very, very, very important NEET question and even a next theory question also. If the breastfeeding is not available, then my replacement should have AFASS. What is that? Anyone? Anyone? Okay. So the answer for this one is that our this one the our replacement feed should be acceptable, affordable, feasible, sustainable, and safe. Very, very, very important. This is an MCQ question. Please remember, the replacement feed will be acceptable, will be very importantly affordable. You can say acceptable, affordable, feasible, and sustainable and safe. Okay. So double A, you need to understand. Understood? This is a good question. This is the exam question actually. So option for individual, अगर breast feed नहीं मिल रहा है तो कोई भी अगर feed दूसरी दोगे तो वो क्या होनी चाहिए? वो acceptable होनी चाहिए, वो अफोर्डेबल होनी चाहिए, वो फीजिबल होनी चाहिए, वो सस्टेनेबल होनी चाहिए और वो सेफ होनी चाहिए. सो दिस AAFSS इज व्हाट वी नीड टू अंडरस्टैंड. एक्सेप्टेबल, अफोर्डेबल, feasible, sustainable and safe. प्लीज पुट अ लाइक बटन इफ यू एबल टू अंडरस्टैंड. समझ में आ रहा है सावन ब्रो? समझ में आ रहा है आपको? जूली, शुभांगी, मनी, वैदही, आर यू getting this question? This is an exam question. This is one of the rare questions. That's why I just thought of taking a test just to understand how much, is your level, where are you exactly, putting up. Okay, so my replacement feed should be acceptable, should be affordable, should be feasible, should be sustainable, should be safe. Good. Done. Question number 47. What is the theme of the World Breastfeeding Week 2021? Now, who will tell that? Let's see if you can answer this one. ये सारे बहुत ही important questions हैं. Actually, मैंने एक quiz conduct किया था recently. I took one a quiz actually on in my hospital in my medical college. So there these questions were there और बहुत ही बुरा result आया था. बहुत बच्चों को नहीं आता था ये. Lot of students didn't know this answer. What is the theme of World Breastfeeding Week? Okay, can anyone tell me the theme of the World Breastfeeding Week 2020 and 2021? दोनों साल का ब्रेस्ट फीडिंग का थीम क्या था? क्या था? इकट्ठे बैठ के दूध पिलाएंगे? क्या थीम था? नहीं, ऐसा तो नहीं था. What was the theme? Julie Tyagi, what do you think? Mani, Savan, Rachna, Shubhangi, our mind-blowing students who will get rank 1. I'm very sure you guys are working really hard. Please remember, dear, the theme of the breastfeeding is nothing but remember this one. The theme for the breastfeeding week 2021 2020-21 is protect breastfeeding, a shared responsibility. Protect breastfeeding, a shared responsibility. And 2020 theme was support breastfeeding for a healthier planet. Okay, support breastfeeding for a healthier planet was the what you called हाँ yes Savan, very true. तेरे को तो आ भी जाएगा तेरा तो मुझे लगता है. तो हाँ जी, so we have a what you called World Breastfeeding Week is first week of August. We all know that. In 2020, the theme was support the breastfeeding for a healthier planet, and 2021, the theme was protect breastfeeding, a shared responsibility. Protect breastfeeding, a shared responsibility. दोनों साल के पता होने चाहिए. If you guys are planning to give any quiz of pediatrics or any general all India level quiz, these are the questions they had asked in the IAP quiz, Indian Academy of Pediatrics. Okay, done. So protect breastfeeding, a shared responsibility. Okay, chalo. Question number 46. What is VABA? What is VABA in a case of breastfeeding? The hint is best breastfeeding. And what is WABA? VABA. आई अंडरस्टैंड क्वेश्चन देख के शायद चक्कर आ गया होगा, लेकिन बेटा ये क्वेश्चन तो आते हैं, इनको पता होना चाहिए. सो प्लीज रिमेंबर व्हाट इज वाबा. वाबा इज नथिंग बट वेरी इंपॉर्टेंट वर्ड अलायंस फॉर ब्रेस्ट फीडिंग. वाबा इज नथिंग बट वर्ड अलायंस फॉर breast feeding. Please write this. Baba is nothing but word alliance for breastfeeding. These all are the see. That's what I always tell you. That's why I always say that reading theory is one point, but doing MCQs is really very important. You need to read the full theory and then do the MCQs. So that's very very important. You must know. Okay, that you should know. Chalo, Hanji. So let's one second. Let me close my WhatsApp. My saying something, saying जम्मू आ जाओ, कैसे आ जाएं आग. हाँ जी. सो वाबा इज वर्ड अलायंस ब्रेस्ट फीडिंग. अंडरस्टूड? यस और नो? इज एवरीवन अंडरस्टैंडिंग? किसी के दिमाग में छोटे छोटे दिमाग में बड़ी बड़ी इन्फॉर्मेशन घुस रही है? पुट अ लाइक बटन इफ यू आर एबल टू अंडरस्टैंड. सो वर्ड अलायंस, दिस वाबा इज वर्ड अलायंस फॉर ब्रेस्ट फीडिंग एक्शन. दैट्स व्हाट यू नीड टू नो. ओके, चलो आगे. व्हाट इज द फुल फॉर्म ऑफ बीपीएनआई in a case of breastfeeding? What is the full form of BPNI? BPNI क्या होता है जी बताओ. डॉक्टर सावन, डॉक्टर रचना, डॉक्टर जूली, डॉक्टर मणि प्रकाश, डॉक्टर शुभांगी कौशिक. व्हाट इज BPNI? इट्स ओके, यू कैन गाइस कैन राइट. अगर ऑप्शन देते तो हर कोई हाँ सर ऑप्शन बता दो, लिख देंगे. सर सर ऑप्शन बता दीजिए सर, आप बिल्कुल बढ़िया सा लिख के आएंगे. हेलो, ऑप्शन इज नॉट देयर. Like this also you should know how to tell. So BPNI, what is BPNI? BPNI is nothing but Breastfeeding Promotion Network of India. Please write BPNI. BPNI is Breastfeeding Promotion Network of India. Breastfeeding Promotion Network of India. This is known as BPNI. Very good. Shubhangi Kaushik is answering. Very good. Very right. Okay, Savan. Very good. PNI मतलब पता नहीं. अच्छा, ओह शॉर्ट फॉर्म, इसकी भी शॉर्ट फॉर्म. ठीक है, कोई बात नहीं, कोई बात नहीं, चलेगा. ठीक है, स्टेफिलोकोकस समझ में आ रहा है. दीज आर द रेयर क्वेश्चंस. अगर ये भी अगर आप कर देंगे तो योर होल टॉपिक इज फुल एज अ होल, इट इज फिनिश्ड. ओके, सो BPNI इज ब्रेस्ट फीडिंग प्रमोशन नेटवर्क of India. WABA is World Alliance for breastfeeding. Word alliance for breastfeeding. Okay, and the breastfeeding theme was protect breastfeeding, a shared responsibility. Last year it was like 2020. It was support breastfeeding for a healthier planet. And remember, if you're giving breast other than breastfeeding, if you're giving any feed, that should be acceptable, affordable, feasible, and sustainable and safe. That you should know. Okay. Okay. Next question. Question number 44. Again, the topic is breastfeeding. What is IMS Act? What is IMS Act? ठीक है, आज सबको चक्कर आएंगे बिकॉज इसने किसी ने कुछ नहीं पढ़ रखा होगा इस बारे में. What is IMS Act? Okay, so again, this is a very importantly again Indian Academy of Pediatrics. It's a all India level quiz contest was there. In there they had asked regarding what is IMS Act. हाँ जी, क्या होता है IMS? डॉक्टर सावन सिंह, पता नहीं, बहुत अच्छी बात है, प्राउड ऑफ यू. The IMS Act, remember my dear, is nothing but very important. Infant is nothing but Infant Milk Substitute Act. Infant Milk Substitute Act. Will not go in detail of this. ठीक है, IMS Act. हाँ, क्या लिखा है सावन ने? 2P2, हाँ जी, to promote the breastfeeding. नहीं, IMS Act is nothing but Infant Milk Substitute. Infant Milk Substitute. It's an easy one. At least full form you should know. Okay, guys, remember, dear my friends, you should know at least full form, because at least MCQ अगर आ गया तो कुछ तो बेइज्जती तो नहीं करा के आओगे अपनी, कुछ लिख के तो आना ही है. So IMS Act is nothing but Infant Milk Substitute. Infant Milk Substitute Act. What is BPNI? Breastfeeding Promotion Network of India. That is BPNI. ठीक है, done? Yes, exactly. Infant Milk Substitute Act. Very good. Next question. Question number 43. First breastfeeding milk bank was started in which year and in which city in India? First breast milk bank. First breast milk bank to keep the breast milk safe, for the babies, right? So the first breast milk bank was started in which year and which city? So what do you think? Anyone? Okay, I'll give you options. Delhi, Jaipur, Bangalore, or Goa. Who will answer? Is it Delhi, Jaipur, Bangalore, Goa? What will you answer? First breast milk bank was started in which city in India? Any random guesses? Okay, Savan says Delhi. Okay, very good. Roshan Mohanty says Mumbai. Okay, so remember, Delhi, Jaipur, Bangalore, Goa कहीं नहीं हुआ था, मुंबई में हुआ था. ठीक है, just वैसे मेरा मन था छेड़ने का. The first breast milk bank was started in which city in India? Mumbai. In which year is not important. Some people says 1989, some people say something else. So at least city is confirmed, Mumbai. मुंबई में हुआ था, बैंगलोर में नहीं हुआ था, कहीं नहीं हुआ था. चार ऑप्शन गलत थे, इधर हुआ था. जो करना कर लो. ठीक है. यस, सो द फर्स्ट ब्रेस्ट मिल्क बैंक वाज स्टार्टेड इन विच सिटी इन इंडिया? मुंबई. एसल वर्ड जाऊंगा मैं, नहीं 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 नहीं, घर आऊंगा मैं. एसल वर्ड याद है, एक ऐड आती थी, सावन याद है तेरे को? ऐसी एक ऐड आती थी ना, मुंबई की एक ऐड आती थी एसल वर्ड वाटर किंगडम की. कुछ था ना, पूरी ऐड किसी को याद है? मुझे पूरी ऐड याद नहीं है. वो एसलवर्ड वाटर किंगडम की ऐड आती थी. आई हैव बीन टू एसलवर्ड वाटर किंगडम टाइम्स. वो कहता ना, कुछ थी ऐड, मुझे याद नहीं आ रही. ठीक है, चलो नेक्स्ट क्वेश्चन. द फर्स्ट ब्रेस्ट मिल्क बैंक was in India, and IMS is Infant Milk Substitute Act. BPNI is Breastfeeding Promotion Network in India. बाबा is World Alliance for Breastfeeding Action. ठीक है. अप्पू घर तो दिल्ली में है. अप्पू घर तो दिल्ली में नहीं है, वहां तो एसएल वर्ड और वाटर किंगडम है, राइट? क्वेश्चन नंबर 42. A newborn baby of 27 weeker period of gestation, can we breastfeed the baby? If not, what is the ideal route of nutrition? चलो शुक्र है, ये तो किसी को आता ही होगा, ये हमने 10 बार कर रखा है. दिस क्वेश्चन हैज बीन डन 20-30 टाइम्स. आई अंडरस्टैंड दिस क्वेश्चन, एटलीस्ट समवन नोस. हाँ जी, सावन, अपू घर तो बंद भी हो गया ना, कोविड की वजह से सब कुछ ही बंद हो गया. हाँ जी. गिव इट, आई हैव. व्हाट शुड आई गिव यू ब्रो? समझा नहीं. हाँ जी, a newborn of 27 weeker, what do you want to give? You want to give breastfeeding? हाँ, so parenteral, yeah, the best answer will be IV, right? Intravenous fluid, IV fluids, less than 28 weeker. Do we remember? Yes or no? Less than 28 weeker baby, what do you give? Less than 28 weeker, we give IV fluids. In more than how many weeks should we give breastfeeding? Anyone? In more than how many weeks baby should we give breastfeeding? Yes, more than 34 weeks, baby, you should give breastfeeding. What about 28 to 31 weeks? 28 to 31 weeks, you give orogastric feed or nasogastric feed. Yes or no? Exactly. So less than 28 weeks, you will give IV fluids. 28 to 31 weeks, you will give orogastric or nasogastric feed. 32 to 34, you will give katori spoon feed or paladai. And more than 34 weeks, you will give, what will you give? You will give the breastfeeding. Breastfeeding. Okay, done? Very good. Question number 41. Breastfeed. Breast milk is rich in which vitamin? Breast milk is rich in which vitamin? Julie Tyagi, Julie Tigri, and Raghuvansh, Mani Tripathi, Dr. Staphylococcus, Dr. Sawan. And the breast milk is rich in, everyone knows that mother will feed the child in AC room. Mother will feed the child in AC room. So breast milk is rich in vitamin A and vitamin C. Question number 40. Breast milk is deficient in which vitamin? Who will tell me that? Breast milk is deficient in which vitamin? So breast milk is deficient in, we all know that breast milk is deficient in vitamin D, vitamin K, vitamin D, vitamin K, and vitamin B12 if she is a pure vegetarian. Okay, that we all know that. Question number 39. True or false? In hot summer, we can give water to a newborn other than the breastfeeding. True or false? गर्मी का टाइम है तो सावन को जो है वो क्या बोलते हैं पानी पीना है सो कैन वी गिव ओनली ब्रेस्ट फीडिंग और वी कैन गिव वाटर ऑल्सो so the answer is yes, exactly. Dr. and Caffeine is right. It's false. We only and only give breastfeeding. We do not give what is called water or any kind of thing. Okay. Question number 38. True or false? Breast milk jaundice is early onset. अब आ जाओ लाइन पे ठीक है हाँ जी अब बताओ क्या होता है व्हाट इज ब्रेस्ट मिल्क जॉन्डिस कहीं पढ़ा था गलती से भगवान की दया से एक होता है सी वन इज ओके लेट मी जस्ट हाँ ओके वन इज नोन एज breast feeding jaundice and one is known as breast milk jaundice. Anyone, what is this? क्या होता है ये सावन आ जाओ बेटा अगर बताएगा तो ही आज रात को नाइट ड्यूटी पे आएगा तू बता रहा हूँ मैं नहीं बताएगा तो तेरे को बुलाऊंगा नहीं आज मैं हाँ जी व्हाट इज ब्रेस्ट मिल्क जॉन्डिस एनीवन मदर ज़्यादा दूध पिलाने से होता है कि कम दूध पिलाने से होता है एनी रैंडम गेसेस what is the meaning? Okay, Savan says it's true. So breast, remember dear Savan, number one, breast milk jaundice happens in 0 to 7 days of life. It is early onset. Whereas breast milk jaundice happens in 7 to 14 days of life. That is late onset. That is the first point. Second important point, if the mother will decrease her breastfeed, the baby will land up into jaundice known as breastfeeding jaundice. If the mother will increase her breast milk, the baby will land up into jaundice. That is breast milk jaundice. ऐसा क्यों ऐसा क्यों होता है कि मदर दूध कम पिलाएगी और बच्चा पीला होगा बिकॉज डिक्रीज ब्रेस्ट फीडिंग लीड टू डिक्रीज इनटेक ऑफ द मिल्क डिक्रीज इनटेक मीन्स डिक्रीज मेटाबॉलिज्म and decrease metabolism means decrease excretion, right? That is known as breastfeeding jaundice. The less the mother will feed her child, the less the baby's intake will be there, the less the baby's metabolism will be there, and the less the jaundice excretion will be there. So jaundice will stay for some time. This is known as breastfeeding jaundice. This is known as breastfeeding jaundice. And what is breast milk jaundice? The more the mother will breastfeed her child, the baby will have jaundice. Why? Because breastfeed has some components. Breast milk has some components which interfere in the baby's bilirubin metabolism. What is that component? Who will tell me? Yes, exactly. Shubhangi is right. Both the jaundice, breastfeeding and breast milk, both the jaundice will have unconjugated hyperbilirubinemia. And what was that component was present in breast milk which causing breast milk jaundice? Anyone? Exactly. Who said the right answer? Very good. Rachna. Rachna told the right answer. Rachna said what? Rachna said beta glucuronidase enzyme, beta glucuronidase enzyme, and 3 alpha 20 beta diol. 3 alpha 20 beta diol and beta glucuronidase enzyme are the two important enzymes which are basically responsible, which are present in the breast milk, but are causing, they interfere in the baby's bilirubin metabolism. That's what. So, causing jaundice. Question 38, true or false? Breast milk jaundice is early onset. That is false. Breast milk jaundice is late onset. Question 37, breastfeeding jaundice is late onset. That is also false. Breastfeeding jaundice is early onset. Has everyone understood this much? Please put a like button or you can share a golden heart or a big heart or a small heart or some kind of heart that you have understood. समझ में आ रहा है या नहीं आ रहा है बताओ. हाँ, Julie is right, 3 alpha 20 beta diol. Very good, very good, very good. समझ में आई कहानी या नहीं आई? Put a like button so that I can continue, everyone. Perfect. चलो, इंडियन अकेडमी, बहुत बढ़िया, आगे बढ़ते हैं. Question 36. True or false? Galactosemia causes macrocephaly. Galactosemia causes macrocephaly. Is this line true or is this line false? What do you think? Raghuvansh, Julie, Savan, Indian Academy, Mani, Shubhangi, Rachna. What do you think? And yeah, Mani. So, what do you call it? Galactosemia causes macrocephaly. Is this line true or is this line false? The latest guideline says yes, this line is true, 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 true. अच्छा, no, no, no करी जा रहे हो, but इसको true बोलते हैं बेटा. The latest guideline says, one second, the latest guideline says that very importantly, one second. Yes, the latest update says this line is true. Galactosemia causes macrocephaly. In the previous guidance it was false, but galactosemia it causes, जो सारे के सारे line से false लिख रहे हैं, the answer is true. Galactosemia actually causes macrocephaly. If you open OPGHI 9th edition, in the various causes of macrocephaly, they have told, you know, what you called that क्या बोलते हैं इसको, it is true. ठीक है, that you should know. दिखाऊं मैं एक बार, one second. कहाँ लिखा है, मैंने पढ़ा भी है पता है. If you need to open Kindle, and in the Kindle, like in the OP guide, basically it is there. बाद में दिखा दूंगा, चलो. I was reading that, so it's true. Galactosemia causes macrocephaly, that you should know. Okay, okay, next one. Okay, टाइम लगेगा ओपन करने में, no problem, leave it. Okay, कहाँ थे हम? Yeah, next question. Question number, yeah, 35. In galactosemia we can give breastfeeding. Is this true or false? अच्छा, you knew previous guidelines. ज़्यादा पढ़ते हो तुम, इतनी सारी गाइडलाइन में पढ़ा करो. हाँ जी. True or false? Galactosemia, in galactosemia we can give breastfeeding. Julie says yes, we can give breastfeeding. Galactosemia is the absolute contraindication of breastfeeding. Absolute contraindication of breastfeeding are galactosemia, mother on chemotherapy, radiotherapy. कौन बोला true? जरा शक्ल दिखाना अपनी, इधर आओ जरा. कौन है? रघुवंश, डॉक्टर रघुवंश मणि त्रिपाठी. The only important absolute contraindication of breastfeeding is nothing but galactosemia. Okay, galactosemia. क्या होता है galactosemia में, कौन बताएगा मुझे? Wait, I have to tell you this part. So in galactosemia, remember everyone, there is whatever the mother is feeding the child, the galactose or lactose, whatever the mother is feeding, whatever the mother is feeding, no, that lactose or galactose gets converted into glucose. Okay, normally with the help of GALT enzyme. With the help of GALT enzyme. GALT is galactose 1 phosphate, galactose 1 phosphate uridyl transferase. Galactose 1 phosphate uridyl transferase. This is the enzyme which is responsible for conversion of galactose into glucose. Normally, in galactosemia, there is a GALT enzyme deficiency. This enzyme is totally, yeah, exactly. So this enzyme is totally absent. Galactose is totally absent. Then what is the problem? Then whatever the mother will breastfeed her child, that galactose will not able to get converted into glucose. So more and more galactose in my brain basically will get accumulated and causes macrocephaly. In my eyes also it can get, you know, damage and can cause cataract. It can cause cataract, very important, you know. And what kind of cataract do you see in galactosemia? It can also cause hepatic liver damage. Baby will die of hypoglycemia because the galactose is not able to get converted into glucose, and the galactose will get accumulated everywhere. And what kind of cataract do you see in galactosemia? Very classical exam question. Yes, oil drop cataract. किसी ने ऑयल का ड्रॉप डाल दिया आंख के ऊपर. So that is one. So galactosemia, the absolute contraindication of breastfeeding, one very very important is galactosemia. Galactosemia. समझ में आ रहा है? जूली, समझ में आया नहीं आया बेटा ब्रो आपको? ठीक है, very true. So understood? Fine. Okay, next question 34. What is the full form of IYCF and BFHI? ये तो बहुत सिंपल क्वेश्चन है. IYCF गाइडलाइंस होती हैं अच्छी खासी, 10 पेज की गाइडलाइंस हैं. What is IYCF guidelines? Anyone? Have you heard the name IYCF guidelines? What is IYCF guidelines and what is BFHI? बहुत easy, ब्रेस्ट फीडिंग से रिलेटेड है ये. दिस इज रिलेटेड टू ब्रेस्ट फीडिंग. दिस इज वेरी IYCF guidelines are very important. So infant and young child, infant and young child feeding guidelines. IYCF guidelines are infant and young child feeding. Very good. Mani Prakash is right. Infant and young child feeding guidelines are the IYCF guidelines. ये 10 पेज की अच्छी लंबी guidelines हैं कि कैसे how to breastfeed a baby properly. So infant and young child feeding guidelines. And what is BFHI? BFHI is baby friendly hospital initiative. Again, baby friendly hospital initiative. We have the various. I'll repeat again. We have IYCF guidelines and BFHI guidelines. IYCF is infant and young child feeding guidelines, whereas BFHI is baby friendly hospital initiative guidelines. ठीक है, समझ में आ गया? ये एटलीस्ट ये full forms, dear, you all should know, right? These you need to know. We have to crack the PG exam. We have to crack any exam in this whole planet, and these are the questions undoubtedly are gonna come. Okay. Sucking and swallowing coordination fully matures by question 33. सावन बता दे आंसर इसका बेटा, जान से मार दूंगा अगर नहीं बताया तो. शुभांगी, डूट, टेल मी द आंसर. रघुवंश, डॉक्टर एंड कैफीन, सेफलोकोकस. बस ऑनलाइन बैठे हो ऐसे करके, बस ऐसे घूरते रहो, आंसर भी बताना है, ठीक है. तो suck and swallow coordination fully matures by, we have done this, right? We have done this, हाँ exactly, by 32 to 34 or roughly by 34, तो for sure sucking and swallowing coordination by 34 weeks is fully matures. Okay, that you should know. 36, my dear, 34, Rachna. Okay, 34, because more than 34 weeker you do breastfeeding. No, if at 34 weeker or after 34 week you start breastfeeding, so I assume that the baby knows how to suck the breast and swallow the milk. So sucking and swallowing fully matures by 34 weeks without fail. Okay, very good. Question 32. Baby fed with bottle feeding, finding it difficult and confusion to suck the breast. Baby fed with bottle feeding, finding it difficult and confusion to suckle at breast is known as, anyone? What do you call this? Very good, Savan. So, what do you call this? You call this nothing but nipple confusion, right? Yes or no? Have you heard of nipple confusion? Again, if anyone has done the recent last 3 year question papers, every single question has come in breastfeeding. ठीक है, पता था, ठीक है, बहुत अच्छी बात है, बहुत अच्छा तो पता था, तो ठीक है, वरना तुम्हारा देखना मैंने तुम्हारा क्या हाल करना था आज. तो निपल कंफ्यूजन, ठीक है. क्वेश्चन 31. What is the kilocalorie requirement of a 7 kg baby? Very easy question. Anyone? Rachna, Julie, Savan, Mani, this Raghuvansh, Mani Tripathi. What is the kilocalorie requirement of a 7 kg baby? What do you think? 7 किलो के बच्चे को कितनी कैलोरीज चाहिए होती हैं, या कितने ml फ्लूइड चाहिए होता है? What do you think? Who will answer? Anyone? Mani, Savan, Rachna, Raghuvansh. क्या आंसर है? पहली बार सवाल सुनना है, फर्स्ट टाइम यू हर्ड दिस क्वेश्चन, कभी ऐसा क्वेश्चन सुना ही नहीं लाइफ में, चक्कर आ गया गलती से. तो हाउ डू यू कैलकुलेट द किलो कैलोरी रिक्वायरमेंट? एनीवन? आई थिंक आई हैव टू टेल यू दिस वन. So remember one thing. So there is something known as holiday and Sagar formula. There is something known as holiday and Sagar formula. What is this formula? It is for formula to calculate the expected kilocalories, or or not even expected kilocalories, to know the expected kind of fluid requirement. Which fluid? Maintenance fluid requirement. This word is very important, maintenance fluid requirement. Okay, how do you calculate? 1 to 10 kg, 10 to 20 kg, and more than 20 kg. For beginning 10 kg, it is 100 ml per kg. Remember, see, kilocal also same thing only, and fluid also same thing only. I'll repeat again. For 1 to 10 kg, the requirement for maintenance fluid is 100 ml per kg. If my child, for example, I'm posted for surgery tomorrow. I am a 7 kg baby who is posted for surgery tomorrow. So you will keep me NPO, right? For the overnight. What is NPO? Nil per oral. समझ में आ रहा नहीं आ रहा? Yes or no? I am a boy, 7 kg. I'm posted for any surgery tomorrow morning. Doctor told the sister that overnight keep the person in NPO. NPO is nil per oral. If now, but whole night you will keep me NPO, I will go into hypoglycemia. So you will give me a maintenance fluid. How much maintenance fluid you will give me for 1 to 10 kg? It is 100 ml per kg. Means for 1 kg we give 100 ml. For 7 kg we give 700 ml. 700 ml. So 700 ml will be the fluid maintenance fluid requirement of a 7 kg baby. At the same time I'm eating well. I'm eating very well, okay? I'm eating very normal, everything is fine. I just want to know how much kilocalories I should consume. I want to know that a 7 kg baby normally consumes how many kilocalories. So the answer is same, 700 kilocalories. तो kilocalories भी same हो जाता है और ml भी same हो जाता है. Has everyone understood this much or should I repeat? First tell me that. Okay. Basant, मनी, सावन, शुभांगी, जूली, रघुवंश, मनी त्रिपाठी, समझ में आ रहा है जो बता रहा हूँ मैं या मैं दोबारा रिपीट करूँ, ये बताओ मुझे. Yes. So 1 to 10 kg, we give 100 ml per kg. For 10 to 20 kg baby, we give 50 ml per kg of the maintenance fluid. We all know that in the big and for the 10 to 20 kg, like beginning 10 kg, the formula will be remain same. For the next 10 kg, the formula will be 50 ml per kg. And for the next more than 20 kg, it will be 20 ml per kg. 20 ml per kg. Exactly. Rachna is right. Yes. समझ में आ गया. चलो शुक्र है, अच्छी बात है. फॉर एग्जाम्पल नाउ इफ आई आस्क यू क्वेश्चन ऑफ 25 kg, a baby is 25 kg, how much kilocalorie requirement, how much kilocalorie requirement does a 25 kg baby need? How much kilocalorie requirement does a 25 kg baby need? What will you answer? So remember, first let me check. Yes, I know the answer. Anyone? Okay, Shubhangi says 600. First, give me your answers. Shubhangi says 600 kilocalories is required for a 25 kg baby. Okay, anyone? सावन तेरा कितना आ रहा है आंसर बेटा बता. Shubhangi, how much? Shubhangi ने बता दिया. Julie, what's your answer? Doctor and Cafe says 500 kilocalories. Okay, very good. Very good, 600 kilocalorie. Let's see what's the right answer. My question is, how much kilocalorie requirement do we need for a 25 kg baby? Last answer, the Basant, he says again 500. Okay, very good. So proud of you. So all three answers are wrong. How come? How come all three are wrong? Please remember, just 25 kg divided into 10 plus 10 plus 5. The beginning 10 kg, the beginning 10 kg, the formula will be according to this one, 100 ml per kg. The beginning, I told you, right? The beginning 10 kg, you will give 100 ml per kg, right? 100 ml per kg or 100 kilocalories per kg. So कितना आया beginning 10 kg का? For 1 kg, 100 kilocalories. For 10 kg, 1000 kilocalories. Okay, number one. For the next 10 kg, the formula will be according to this one. The next 10 kg, 50 ml per kg or 50 kilocal per kg. तो क्या आंसर आया? Yes, the answer came 500, right? Plus जो अगला 5 किलो है, the next 5 kg will be according to this formula. That is 20 ml per kg or 20 kilocalorie plus kg. तो कितना आया? It came 100. So 1000 plus 500 plus 100, the answer is 1600. 1600 kilocalories is the requirement for a 25 kg baby. Now you can say 25 kg baby 1600 ml fluid requirement also same, and 25 किलो के बच्चे को 1600 कैलोरीज चाहिए होती है हर 24 घंटे में. दैट ऑल्सो इज सेम. डन. समझ में आया कि अब समझ में आया कि नहीं? 1650 बन रहा है. कैसे बन रहा है 1650? 1600 बनना चाहिए ना. 1650 कैसे आ रहा है रघुवंश? This 5 kg, it is 20 ml per kg, right? 20 ml per kg means for 1 kg baby 20 ml is required. For 5 kg baby 100 ml is required. So 100 only is coming. No, total is 1600. Then कोई बात नहीं. समझ में आया कि नहीं आया रघुवंश? इट्स ओके, चलेगा, गलती हुई चलेगा, बट समझ में आया या नहीं आया? ठीक है, कोई बात नहीं. मणि प्रकाश, नो प्रॉब्लम. लास्ट क्वेश्चन, आई थिंक आई नीड टू आस्क यू वन मोर. दिस वन, हाँ, 30 kg baby. I have a 30 kg baby. Last MCQ. Well, I want to double check, That's okay, Raghuvansh, no problem. I want to double check that you guys have understood. 30 kg baby, how much ml maintenance fluid is required, or I can say how much kilocalorie a 30 kg baby needs. And I'm just writing 1 to 10 kg, we use 100 ml per kg. 10 to 20 kg, we use 50 ml per kg, for more than 20 kg 20 ml। तो कितना आंसर आ रहा है? व्हाट इज द आंसर कमिंग नाउ? एक आंसर बताओ तमीज का, देखता हूँ मैं कौन सही है कौन गलत। टेल मी वन गुड आंसर। हाँ, कितना आ रहा है? वेरी गुड। पावन कहाँ है इसके अंदर? ठीक है, जूली, शुभांगी, डॉक्टर, चंद्रकला, मनी, वेरी गुड। So again, you know that 10 plus 10 plus 10, the beginning 10 kg will be according to 100 ml per kg, which is coming 1000 ml. The next 10 kg will be according to 50 ml per kg. 50 into 10 is 500, that is one another one. And then another 10 kg is based on 20 ml per kg. That will be roughly around 200 ml. So 1000 plus 500 plus 200, 1700. A 30 kg baby needs 700 ml of fluid, you can say, or 700 किलो कैलोरीज। अब समझ में आया या नहीं आया? सावन ने क्या डिलीट किया समझ में? ठीक है, डन? नो, एवरीवन अंडरस्टूड राइट? कैन वी मूव फर्दर? ओके, थैंक यू। दैट शोज रिवीजन प्लेज सच एन इंपॉर्टेंट रोल। मैं तो यूं ही पढ़ा रहा हूँ, एवरी 2 days आफ्टर आई विल टेक अ टेस्ट। आई एम वेरी श्योर आई शुड टेक अ टेस्ट ऑफ योर्स। ऐसे तो तुम चक्कर खाए गिर जाओगे एग्जाम में। ट्रू और फॉल्स? हाइंड मिल्क क्वेंचेस द थर्स्ट। हाइंड मिल्क बच्चे की प्यास बुझाता है, क्या ये बात सच है या क्या ये बात झूठ है? हाइंड मिल्क quenches the thirst. Is this line true or is this line false? Very good. So Raghuvansh says yes, this line is true. Okay, very good. So Mani says yes, this is true, and Raghuvansh says yes, this is true. Okay, okay. Shubhangi also says yes, this is true. शुभांगी, अपने घर का एड्रेस बताना, तुम्हें मैं वहाँ आके मारता हूँ। तुमने कैसे बताया ये? हाइंड मिल्क, हाइंड मिल्क, हाइंड, मैंने बोला हाइंड मिल्क क्वेंचेस द थर्स्ट। हाइंड मिल्क बच्चे की प्यास बुझाता है। व्हाट इज हाइंड मिल्क? व्हाट इज फोर मिल्क? आई, वन सेकेंड, लेट मी जस्ट राइट ऑन अ पेपर। कहाँ गया PowerPoint? Okay, I'm just finding a paper. Okay. Have you heard of foremilk and have you heard of hindmilk? क्या difference होता है? What is the difference? Foremilk is the beginning part of breast milk is known as the foremilk. The end part of breast milk is known as the hindmilk. Foremilk, yeah. Okay. Milk basically, milk has all the proteins, vitamins, minerals, but fat fat is there in the hind milk. And milk बच्चे की प्यास बुझाता है. Milk helps in relieving the thirst of the baby, whereas the satiety value, or what is satiety? Stomach fullness value, or you can say the hunger of the baby is present in the hind milk. तो मैंने ये लाइन लिखी थी, मैंने, I'll repeat again. The beginning part of breast milk is the foremilk. The end part of breast milk is the hind milk. Foremilk has all the proteins, vitamins, and minerals, but star mark means exam question. The fat is there in hind milk. Star mark. Foremilk helps in thirst. If I come from gym and have full one bottle of water, then I'll be relieved. My thirst will be relieved, right? But will I get protein? Will I get fat in that water? Will I get satiety value? No. The satiety value or the stomach fullness or the hunger, the main hunger is present in the hind milk. Okay, that's why. So I am saying my line over here was कंच लग गया PDF, yeah. My line here was that hind milk quenches the thirst. This line is false. Does hind milk quenches the thirst? No dear, it is the fore milk which quenches the thirst. Quenches मतलब बुझाना, thirst मतलब प्यास। समझ में आया या नहीं आया ये बताओ पहले। हाँ जी, true, true, true. Okay, okay. So Rakesh Jakhar says, Sir, I seen all your videos in December FMG exam. I got 207 all because of you. Thank you Rakesh, thank you. God bless you. Wish you get everything in life. अभी तो बस शुरुआत है, अभी तो देखते जाओ, कहते हैं ना अभी तो पार्टी शुरू हुई है। ऐसे मस्त होके पढ़ो, सब कुछ तुम्हारा, सब कुछ तुम्हारा। तो बॉर्न टू रॉक, ऑल आई नो। समझ में आया कि नहीं आया? ओके, exactly. Doctor and Caffeine says that's why we tell the mother to empty the breast before shifting the baby to the next breast. Yeah, that's very true. ठीक है, चलो आगे बढ़ते हैं. I think by doing this session, I mean that's a confirmation, that we need to do a lot of tests. We need to do a lot of tests. 2 days I will teach, third day I'll take a test, fourth day I'll take a motivation class. Okay, question number 29. Name the component in the breast milk which prevents the baby from malaria. Anyone? This is a very easy question. What is the name of the component present in the breast milk which prevents the baby from malaria? ये बहुत पुराना, बहुत 100 साल पुराना क्वेश्चन है, ये 100 साल पुराना. बताओ. द कॉम्पोनेंट, व्हाट इज द मदर जब अपने दूध बच्चे को दूध पिलाती है, यस, द कॉम्पोनेंट प्रेजेंट इन द ब्रेस्ट मिल्क विच प्रिवेंट्स द बेबी फ्रॉम मलेरिया इज पाबा. व्हाट इज पाबा? पाबा इज पैरा अमाइनो बेंजोइक एसिड. पैरा अमाइनो बेंजोइक एसिड is the component present in the breast milk which prevents the baby from malaria, okay. Very good. Question number 28 and 27 are important. Name the component present in the breast milk which prevents the baby from Giardia Lamblia infections. Now, this is one hi-fi question. Two super specialty questions are there. Name the component in the breast milk which prevents the baby from Giardia Lamblia infection and Entamoeba histolytica infections. Now, these two important components we must understand. Zainab Akhtar, after a long time you have come. Very good. Pava is the right answer. So, Giardia, Lamblia, and E. histolytica. Please update in your notes. Please updates in your notes. Question number 27. So, yes. So, most importantly, two things. Lactoferrin. Lactoferrin. The component present in breast milk which prevents the baby from Giardia, Lamblia infection is lactoferrin. Before it was bifidus factor, but now the Nelson says lactoferrin. The component present, yes, yeah, everyone is right. Zainab Akhtar is right, Shubhangi is right, Savan is right. The component, lactoferrin, Savan. The component present in breast milk which prevents the baby from Giardia lamblia infection is lactoferrin, and from E. histolytica infection is lysozyme. ये दो चीज प्लीज अपडेट इन योर नोट्स, ठीक है. एंटेमीबा हिस्टोलाइटिका, लाइटिका लाइटिका लाइसो लाइसो एल एल लाइटिका लाइसोजाइम. So the component present in breast milk is lysozyme, which prevents from E. histolytica infection, and lactoferrin, which prevents from Giardia lamblia infection. Giardia lamblia infection. Okay, remember. Question number 25. Okay, 1 second. 21 second. 6 हो गया ना. 26, 25, 25. ओके, 1 सेकेंड. कहाँ चले गए हम? चलो 25 करते हैं. क्वेश्चन 25. या colostrum is rich in IgG. Is this line true or is this line false? Colostrum is rich in IgG. Question number 25. Colostrum is rich in IgG. Is this line true or is this line false? Question number 25. Who will say? Doctor and caffeine. ओके ओके, क्या बात है. अच्छा, ओहो, शुक्र है भगवान का, जूली ने सही आंसर कर दिया. बहुत बढ़िया, बहुत बढ़िया. तुम्हारी बेइज्जती होती है, बड़ा अच्छा लगता है मुझे, बड़ा बड़ा मज़ा आता है. तो रिमेंबर, प्लीज रिमेंबर, यू नो, कोलोस्ट्रम इज रिच इन IgA. Colostrum is rich in immunoglobulin A. Remember, it is not IgG, it is IgA. ठीक है, समझ में आ गया. रघुवंश, सावन, डॉक्टर सावन सिंह, घर जाओ. डॉक्टर एंड कैफीन, सही जवाब दो. रघुवंश, मनी त्रिपाठी, गुड. But good, you're trying. Good, you're trying. Acha, in infectious disease, in a chapter of infectious disease, we have some disease. वहाँ पर भी there is IgA deposition. Can you tell me any disease or where there is IgA deposition? Anyone? अच्छा, doctor and caffeine, auto correction. Okay. So, do we know any infectious disease where there is IgA deposition? There is a IgA deposition in my skin leading to palpable purpura. There is a IgA deposition in my joints leading to arthritis. There is a IgA deposition in my intestine. यहाँ लिखता हूँ, intestine, leading to postprandial bowel angina. Postprandial bowel angina. There is a IgA deposition in my kidneys leading to massive hematuria. So which condition do you see IgA deposition? Yes, the answer is HSP. What is HSP? Hinong Schonlin purpura. Okay, so Hinong Schonlin purpura, that is important. That is one condition where you see palpable purpura. It's a tetrad. HSP has a tetrad of arthritis, palpable purpura, postparental bowel angina, massive hematuria. It's a tetrad. Tetrad, चार चीजें होती हैं इसके अंदर. There's a IgA deposition. So we have to link and study. Very good, Savan Singh. Very good, Julie, Raghuvansh, Basant, and Doctor in Caffeine. Very good. ठीक है. So so colostrum is rich in IgA, and IgA deposition is there in our what you call this thing, HSP. Okay, done. समझ में आ गया? Very good. Perfect. चलो भला. Okay. Name the component, क्या है? Name the component which can lead to breast milk jaundice. Yeah, what was that component? What was the name of that component? Question number 24. आज तो सारे यही questions ही हो गए. Test इसी का test चला गया आज तो. 5 more minutes, then this class is over. Then I have to go for shaving. Okay. The component which can lead to breast milk jaundice are 3-alpha 20 beta diol, 3-alpha 20 beta diol, and beta glucuronidase enzyme. 3-alpha 20 beta diol and beta glucuronidase enzyme. Perfect. Yes, that's right answer. Which is the first meal of the baby? Question number 23. Which is the first meal of the baby? खाली जूली खाली बीटा ग्लूकुरोनाइडेज बताने से कुछ नहीं होगा. 3-alpha 20 beta diol also you must know. Okay, which is the first meal of the baby? The answer is the first meal of the baby is nothing but colostrum is the first meal of the baby. Which is the first immunization of the baby? Yes, the first immunization of the baby also is like colostrum. Colostrum is so important. Colostrum is even it is known as the first immunization of the baby. Next question. What is this? Name the spotter. What is this thick yellowish substance? Thick. It was a FMG question. It was a recent FMG question. Thick yellowish substance. What is this? This is nothing but colostrum. The first meal. The quantity is less, but the consistency is thick. The quantity is less and consistency is thick. Okay, question number 5 more minutes. Okay, fatty acid present in breast milk, which is important for growth and development, is what? Which is the fatty acid present in the breast milk, which is important for growth and CNS development? Anyone? Which is that fatty acid? Any random guesses? Rachna, Shubhangi? Yeah, exactly. DHA. What is DHA? Docosahexaenoic acid. Very good, very good. So DHA, docosahexaenoic acid, is the predominant, kind of a fatty acid present in for the growth and CNS development and eyes development also. Question 19. Which is the predominant carbohydrate present in the breast milk? Which is the predominant carbohydrate present in the breast milk? Anyone? The carbohydrate, there's only one carbohydrate present in the breast milk. Important. Exactly, yes. Which is the predominant carbohydrate present in the breast milk? The answer is lactose. The exactly, lactose. That's why breast milk is very sweet. ब्रेस्ट मिल्क इज वेरी स्वीट. ओके, माँ का दूध बहुत मीठा होता है. माँ का दूध बहुत मीठा होता है अगर पिया हो तो इट्स वेरी स्वीट. द प्री डोमिनेंट कार्बोहाइड्रेट इज प्रेजेंट इन द ब्रेस्ट मिल्क इज लैक्टोज. कितना होता है डॉक्टर सावन सिंह, कितना होता है? हाउ मच ईच 100 ml ऑफ जूली? Each 100 ml of breast milk contains how many gram of lactose? Who will tell me? Basant, Bhangi, Mani, Doctor and Caffeine. Each 100 ml of breast milk contains how many, what you call, how much gram of lactose? Who will tell me? कौन बताएगा? मुझे भी नहीं आता. कौन बताएगा? सावन से 7.4. 7.4, dear. Please remember 7.4 and 4.7. Each 100 ml of breast milk contains 7.4 gram of lactose, and each 100 ml of cow's milk contains 4.7 gram of lactose. So 7.4 and 4.7. Good afternoon, Pancake. I should say good morning. Hello everyone. Can we say good morning to Pancake? Good morning, Pancake. बहुत जल्दी आई हो, बहुत जल्दी. Very nice. Morning we had a 1 hour session. You were not there. Now 55 minutes over. Only 2 minutes left. This session will be over. Now, madam, you have come. Mithai, chai, pakode, samosa. You want samosas or you want Maggi, hakka noodles? What do you want? Okay. So each 100 ml of breast milk contains 7.4 gram of lactose, and what do you call it, 4.7 in the which this one milk, गाय के दूध में. I was sleep. I can see you were sleeping. Manorma, I know you were sleeping. True or false? Prolactin oozes out the milk and oxytocin produces the milk. Hanji, is this line true or is this line false? Raghuvansh, Shubhangi, Pancake, okay, Savan, Doctor and Caffeine. Yeah, Doctor and Caffeine. Very good, Doctor and Caffeine. This line is false. Actually, ulta hona chahiye. Prolactin produces the milk and oxytocin oozes out the milk. Right? That you should know. Question number 17. What are the signs of good attachment? What are the signs of good attachment? I only will tell you because it's a long thing to write. So chin touching the breast. I think we have a photo also. Let me just check. Yeah. So kind of a this one, like this photo says something else, but just remember this one. So chin touching the breast, mouth wide open with fullness of cheeks, chin touching the breast, mouth wide open with fullness of cheeks, lower lip, the baby's lower lip is everted out, and baby's upper areola is no, not baby, sorry, mother's upper areola is exposed out. That is nothing but what you called, yeah, exactly. So I'll repeat again. Chin touching the breast, mouth wide open with fullness of cheeks, baby's lower lip is everted out, and mother's upper areola is exposed out. That you should know. Okay, these are the signs of good attachment. Okay, very good. Okay, question number 16. The alternate name for drought reflex. Yeah, this is a good question. Let's see if you can answer. Pancake, Shubhangi, Savan. Yes, very good, very good. Rita. So, what is the alternate name for drought reflex? DRAUGHT, drought reflex. Is it the milk secretion reflex or is it the milk ejection reflex? इतना मैं hint दे सकता हूँ. Drought reflex होता है. Is it the milk secretion reflex or is it the milk ejection reflex? Question number 16. The best answer to this for question number 16 is nothing but very important. This is nothing but the alternate name for drought reflex is milk ejection reflex. तुक्का सही मारा पर गलत हो गया तेरा सावन. So milk ejection reflex is nothing but yeah, milk ejection reflex is known as the drought reflex. Milk ejection, that is known as the drought reflex. Okay. Acha, this one, prawn position is not recommended after feeding to decrease the incidence of dash. Anyone? और उल्टा करके माँ को दूध पिलाने के बाद बच्चे को उल्टा करके नहीं सुलाना चाहिए. क्यों? क्योंकि क्या हो जाता है, क्या प्रॉब्लम हो सकती है? सुला दो, क्या प्रॉब्लम है उसको, क्या प्रॉब्लम हो सकती है? वाई यू डोंट एस्पिरेशन, या बट मोर देन एस्पिरेशन तो हो सकता है. एंड वन इंपॉर्टेंट थिंग वी नीड टू अंडरस्टैंड इज वेरी इंपॉर्टेंट, सिड्स. व्हाट इज सिड्स? सिड्स इज सडन इन्फेंट डेथ सिंड्रोम. सिड्स का चांस होना बहुत इंपॉर्टेंट है. ये एग्जाम क्वेश्चन आता है. सडन इन्फेंट डेथ सिंड्रोम. माँ के दूध पिलाने के बाद बच्चे को उल्टा एकदम नहीं लौटाना है. क्या हो जाएगा उससे? सिड्स हो जाता है. सिड्स क्या होता है? सडन इन्फेंट डेथ सिंड्रोम. सडन इन्फेंट डेथ सिंड्रोम सिड्स हो जाता है. ये सिड्स वर्ड इंपॉर्टेंट है. प्रोन के बाब करने पे बच्चे को, मतलब डोंट आफ्टर फीडिंग द चाइल्ड डोंट पुट हिम ऑन प्रोन पोजीशन, द बेबी कैन लैंड अप इनटू सिड्स. सडन इन्फेंट डेथ सिंड्रोम. Yes. Question 14. Let's finish this now. 2 minutes left. This class is over. Kangaroo mother care can be done after the weight of infant. How many kg? Kangaroo mother care. A, B, C, D. Kangaroo mother care can be done after weight of infant is how much? Options are 1 kg, 1.5 kg, 1.8 kg or 2 kg. The best answer to this question is nothing but pancake says 1.5. Okay. The best answer is 1.8. 1.18 gram, 1.8 kg baby we start the KMC. Less than 1.8 also we can do if the mother is hemodynamically stable. डॉक्टर सावन सिंह थोड़ा तमीज़ का आंसर करो. 1800 ग्राम, 1800 ग्राम का बच्चा जो होता है और 1800 से ऊपर का, उस पे हम KMC करते हैं. कैन वी गिव लेस देन 1800 ग्राम बेबी KMC? Yes, if the baby is hemodynamically stable. But the ideal weight, the book says 1800 start off without fail. Okay. Content of vitamin D in the breast milk per liter is how much? Nelson. So how much is the vitamin D in the breast milk each 100 ml? 4 to 10 units, 400 international units, 100 to 200 international units, or 12 to 60 international units. A, B, C, D. How much vitamin D? See, we know, right, that vitamin breast milk is deficient in vitamin D. कितना कम? कितना? कितना कम? तुम्हारे मेरे जितना कम? कितना कम? आंसर टू द क्वेश्चन विच आई आस्क इन माई IG प्रोफाइल. क्या पूछा था डियर? मेरे को खोलना पड़ेगा मुझे. दैट वन चेक. अच्छा वो, why there is delayed IQ in Down syndrome, what are the poor prognostic factor in HIA? These वो तो those questions dear has a very long explanation. बहुत लंबे लंबे आंसर्स हैं. I'll send you someday. I'll send you those answers. Those are very long answers. The one I have sent on IG. Hmm. Who said the best answer? The best answer to the B कैसे हो गए? इधर आ जा तू सावन, इधर आइयो. सावन ये बताइए जरा, विटामिन डी कितना देते हैं? तू इधर आजा मेरे पास। डॉक्टर सावन सिंह, एक बात बताओ यार, हाउ मच वाइटामिन डी, हाउ मच वाइटामिन डी डू वी गिव टू अ न्यूबॉर्न? हाउ मच वाइटामिन डी डू वी गिव टू अ न्यूबॉर्न बेबी? व्हाट इज द आंसर? हम्म, कितना देते हैं वाइटामिन डी? Normally, we give vitamin D 400 IU. Yes or no? Normally, we give vitamin D 400 international units to a baby. अगर ब्रेस्ट मिल्क में ही 400 होने लग गया तो फिर देने की क्या जरूरत है? आर यू अंडरस्टैंडिंग? By each, for term baby we give 400 units vitamin D. You are saying breast milk contains 400 units vitamin D. Then why do we give vitamin D? Breast milk is enough, no? Yes or no? तो इसलिए विटामिन डी मतलब 400 ब्रेस्ट मिल्क में नहीं होता ना, कम होता है, कम होता है. So question number 13, the best answer is 20 to 60. 20 to 60 units. Mother's milk is deficient in vitamin D. It has 12 to 60, roughly like 12 to 60 units of vitamin D. And normally we give 400 to a term and 800 to a preterm. Right, done? Understood? Yes or no? Question 13, over, okay? Let's do fast. Question number 12. To maintain the adequate lactation, mother should express her breast milk at least how many times in a day? To maintain, so 12 questions left. Should we do it later or should we finish it off now? Okay, tell me fast. To maintain the adequate lactation, mother should express breast her milk how many times in a day? How many times in a day? Okay, Pancake says 10 times in a day. So question number 12, the best answer is yes. The question number 12 is 8 to 10. Very good, Manorma. Very good, Pancake. So yes, 8 to 10 times. A mother should breastfeed at least, express breast basically at least 8 to 10 times per day to maintain the adequate lactation. Adequate lactation, it's a Nelson question. Okay. Question number 11. After how many days of birth of a newborn must a mother's breast feel empty after feeding? After how many days of birth of a newborn must a mother's breast feel empty after feeding? कितने दिन बाद मम्मी को लगना चाहिए कि हाँ मेरे दूध पिलाने के बाद मेरे ब्रेस्ट को एम्प्टीनेस फील हो रहा है बोल के? So, question number 11, it's a all India level question. Yes, exactly. Again, Pancake is right. So, basically, day 6. By day 6, a mother should feel that her breast is empty after every feed. Very good. So, option number D is the right answer. सबसे आंसर देख लिया, सबने आंसर देख लिया, कौन से वाला देख? अच्छा, अगला वाला आंसर देख लिया, ये कह रहे हो? अच्छा, ठीक है, इतना दिमाग है, अगला भी देख रहे हो, चलो अच्छी बात है. So Raghuvansh, the best answer is D. Yes, you are right. Very good. Question number 10. Which of the following is present in breast milk for repair of intestine? For the repair of intestine, again, breast see, can we see that breast milk has so much benefits? इतने सारे benefit हैं. वो मलेरिया से बचाता है, पाबा है उसमें, उसमें ये है, वो कितना कुछ है, right? Yes. So the best answer is epidermal growth factor. Yes, Julie is right. Which of the following is present in breast milk for repair of the baby's intestine? The answer is epidermal growth factor. Question 9. Fore milk is rich in vitamins, proteins, and minerals, but hind milk is rich in? Hind milk is rich in anyone? Hind milk is rich in what? Hind milk is rich in? Yes, it is rich in fat. Very good. Yes. Question 8. In which of the following is the breastfeeding contraindicated? Yeah, there was one this thing also. Other than galactosemia, lactose intolerance, there was one infection also where the what you call book says that breastfeeding is contraindicated. So question number 8. What is the best answer? Is it hepatitis A, hepatitis B, herpes, or varicella zoster? So herpes simplex. Herpes simplex is the best answer. Question number C. Herpes simplex infection, breastfeeding is contraindicated. Question number 7. Which of the following is not recommended in newborn born to HIV positive mother? What is not recommended? Which of the following is not recommended in newborn born to HIV mother? Question number 7. What do you think? Varicella, no, no pancake, not the varicella. Herpes simplex is the better answer. Okay. So what is not recommended? The answer is mixed feeding is not recommended. Mixed feeding. Mixed feeding is not. Either you give only breastfeeding or you give only the what you call top feeding. Top feeding मतलब powder feeding. Okay. Don't mix it. कि तुम कभी ब्रेस्ट फीड करा रहे हो और कभी कटोरी चम्मच से बाहर का दूध दे रहे हो, नो. Give only and only exclusive breastfeeding, but mixed feeding is not allowed. Mixed feeding is contraindicated. Question 6. Breastfeeding is contraindicated in tuberculosis till mother has taken therapy for how many weeks? This is also a very common question. Normally, if the mother is having TB, she shouldn't directly breastfeed her child. She can expressed breast her milk, and someone else can give the baby. But if she has taken anyone, how many weeks of ATT? If she has taken, she is allowed to breastfeed herself. The answer is 2 weeks. So if she has taken 2 weeks of anti-tubercular therapy, she can nicely directly breastfeed her feed to herself. Question number 5: breastfeeding reduces the under 5 mortality rate by how many percent? See, can we understand by this whole 50 MCQs that breastfeeding is so important, so important, so important? क्या क्या फायदे नहीं है breastfeeding के? हजार फायदे हो गए, हजार कम से कम. So breastfeeding reduces under 5 mortality rate by how many percent? Anyone? कितने प्रतिशत under 5 mortality rate कम करता है breastfeeding हमारा? Question number 5. So question number 5, without showing the other question, the answer is nothing but 13%. 13%. Breastfeeding से 13% under 5 mortality rate कम होता है. 13%. Okay. सावन से 40%. हाँ, घर की खेती है, कुछ भी लिख दो, है ना. सो ब्रेस्ट फीडिंग रिड्यूसेस अंडर 5 मोर्टेलिटी रेट बाय 13%. 13% कम होता है. एंड इस बाय फार मोस्ट इफेक्टिव मीन्स ऑफ रिड्यूसिंग चाइल्ड मोर्टेलिटी. द मोस्ट इफेक्टिव means of reducing a child mortality is by breastfeeding. Question number 4: arrange the order. Content of vitamin K is more in what? Arrange the order in more. सबसे ज़्यादा किस में होता है? Options are breast milk, cow's milk, formula feed milk. What do you think? Arrange the order. Content of vitamin K is more in what? ब्रेस्ट मिल्क में ज़्यादा होता है विटामिन के, गाय के दूध में ज़्यादा होता है कि फॉर्मूला फीड में ज़्यादा होता है? किस में ज़्यादा होता है? एनीवन? व्हाट डू यू थिंक? Yes. So the answer for question number 4 is, very importantly, remember, yes, breast milk. Of course, the vitamin K is more in cow's milk देन इन द फॉर्मूला मिल्क. एंड सबसे कम इज इन द ब्रेस्ट मिल्क. सबसे ज़्यादा होता है हमारे गाय के दूध में. रिमेंबर, जैसे वर्बली याद रखना, गाय के दूध में विटामिन के बहुत ज़्यादा होता है, फिर फॉर्मूला फीड में ज़्यादा होता है, और अगेन ब्रेस्ट मिल्क में सब कुछ कम होता है. विटामिन डी भी बहुत कम था, 12 to 60 आयु था, और विटामिन के भी बहुत कम था. ऐसे करके याद. यू गेव करेक्ट आंसर. वेरी गुड, वेरी गुड. जूली गेव द करेक्ट आंसर. वेरी गुड जूली, वेरी गुड. Question number 3. Content of sodium in breast milk. Yeah, this is a good question. Anyone? What is the content of sodium in breast milk? कौन बताएगा? What is the content? How much milliequivalents per liter? Pancake. Very good. What do you call it? What is the content of sodium in the breast milk? Any random guesses? कितना होता है सोडियम? हाँ, कोई आंसर नहीं करेगा. अब बताओ, कोई जबान क्यों नहीं खोलता कोई? द आंसर इज 7 मिली इक्विवेलेंट लीटर. The content of sodium in breast milk is 7 milli equivalent per liter. Okay, the content of sodium, yeah, exactly 7 to 10. Pancake सीधा 135. अच्छा, तुम्हारा सोडियम नहीं पूछ रहे, गाय भैंस का पूछ रहे हैं, ठीक है. तो ब्रेस्ट मिल्क का पूछ रहे हैं. तो कंटेंट ऑफ सोडियम इन ब्रेस्ट मिल्क इज नथिंग बट 7 मिली इक्विवेलेंट पर लीटर. ओके, वेरी गुड. नेक्स्ट, क्वेश्चन नंबर 2. व्हाट इज दिस? लास्ट 2 क्वेश्चन इन दिस क्लास इज ओवर. हाँ जी, ठीक है. व्हाट इज दिस इमेज? व्हाट इज दिस इमेज? ये क्या है? ये क्या है? वेरी गुड इमेज. व्हाट इज दिस इमेज? ये क्या है? मदर यहाँ कप ले रखा है, और कप से यहाँ फीडिंग चालू है, और बच्चे को लग रहा है कि वो मदर का ब्रेस्ट फीड से वो कर रहा है. आई मेड दिस क्वेश्चंस बाय माई सेल्फ, पैनकेक. I made this question by myself, and I took help of my toppers juniors from Jammu and various places. So they helped me a lot. So artificial is known as supplementary suckling technique. Supplementary suckling technique is known as supplementary suckling technique. SST. Okay, that you should. Okay, yes. ये धोखा है. हाँ, ये एक्चुअल धोखा है. और बेबी को लग रहा है कि ये आप ब्रेस्ट फीडिंग से रहा है, लेकिन आ नहीं रहा, पीछे से आ रहा है, कहीं और से आ रही है वो. तो ये दैट्स हाउ इट इज. ठीक है. हाँ, टेलीफोन. यस, माय वाइफ फोन इज रिंगिंग. लंच, come and see. So this is known as supplementary suckling technique. And last question, then I have to go for shaving. I have duty at 4 o'clock. 3 o'clock I will leave house. This one. Each 100 ml of breast milk contains how many kilocalories, how many proteins, how many gram of fat and how much carbohydrate? Tell me fast. Tell me everyone, tell me fast. So each 100 ml of breast milk contains how many kilocalories? So it contains, Osama, yes, it contains 65 kilocalories. How much gram of proteins? 1.1 gram of proteins. How much fat? Fat कौन बताएगा? Carbs तो पता है, 7.4 gram of lactose basically it contains. And what about the fat? Anyone? Fat कितना होता है? Fat कितना होता है? Fat उनमें कितना है? फैट, सावन में फैट है 99% फैट है सावन के अंदर। और ब्रेस्ट मिल्क में कितना फैट होता है? एनीवन? यस, दिस इज अ गुड क्वेश्चन। या 67 किलो, 65 to 67 you can say that, 1.1 gram of proteins, 4 gram of fat and 7.4 gram of carbs। ये भी 65 to 67 कहते हैं। डन, दैट्स इट। समथिंग समथिंग क्या क्या समथिंग? बारात में आया मेरी समथिंग 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 नहीं चलेगा, ठीक है? दैट्स इट। यू हैव, अच्छा एवरीवन हैज 100% फैट, आई हैव लेस फैट। Kidding. Thank you so much, everyone. Thank you so much for this wonderful participation. वैसे आज today we had to discuss congestive cardiac failure part 2, but we end up discussing the whole what you called cardiology questions. And before leaving, again a very beautiful quote. And yes, ओसामा से हमें लगा 2 बजे क्लास है। नहीं ब्रो, 2 बजे क्यों क्लास है? 1 बजे क्लास थी डियर। पे लिखा तो है 1 PM, मैंने लिखा भी था डियर। कोई बात नहीं ओसामा, बाद में देख लेना फिर इसको। हाँ जी, सो बिफोर लीविंग वी हैव दिस अमेजिंग कोट, वी आर नेवर fully what you call dressed until we are never fully dressed until we wear beautiful smile on our face. We are never fully dressed until we wear beautiful smile on our face. So moral of the story is, keep smiling, be happy, life is just one. Thank you so much, everyone. Thank you for this wonderful participation. Have a lovely evening ahead. Now today we're not gonna study. Tomorrow we have a class. अगर किसी को मन हो जानने का अगली क्लास, तो मैं बता ही देता हूँ अभी। So the next class we have is tomorrow, because today I have a night. And the session, the we'll be taking to, कल क्या तारीख क्या है? Well, yes, tomorrow is 20th January. 20th January, I have a class at 1 o'clock. 1 o'clock and 5 o'clock on YouTube channel only, on here only YouTube channel. I have a class at 1 o'clock and 5 o'clock on the X-rays. Top class X-rays we're going to discuss at 1 o'clock, and roughly on 5 o'clock. X-rays is the class. I'll show you 100 X-rays, and again, one by one, we'll try to discuss those X-rays of pleural effusion and various congenital hearts, and even effusions, RS, endocrine, many cases we're going to discuss. Okay, X-rays, 100 X-rays. Thank you everyone. Take care. Bye bye. See you soon. Take care. Have a wonderful day.